station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
Wherever you are, I want to say a special welcome to this HSA interview. Right now in studio, we have Dr. Ike. I hope I can get the name correct. Ikechi Okpechi?
Yeah, Ikechi Okpechi. And that's why I go by Dr. Ike.
Dr. Ike, okay. Well, welcome, on behalf of the Health Services Authority. There's a myriad of questions in which we're going to be talking about today. And first up is that of the dialysis service over inside of HSA. Doc, welcome. And first up, what exactly is dialysis and why is it so important?
Thank you, Preston, and thank you for your radio station hosting HSA today to talk about something really, really important on the island, dialysis. And I think this is something that will interest a lot of people on the island because of the burden of kidney disease that we have in Cayman Island. So simply, dialysis is just a way of treating people who have kidney disease. Kidney disease has various stages, about 5 stages. The earlier stages 1, 2, and 3, patients are okay. But when you get to stage 4 and stage 5, then the kidneys cannot perform their function, effectively. And what are those functions? It's excretion of water, excretion of waste products in the blood, and toxins, and normalization of acid base in the blood and control of electrolyte. And when the kidneys cannot do this anymore, which is the later stage of chronic kidney disease, then the patient needs support. So dialysis then is the way where such people are treated, to get rid of excess water from the body, to get rid and control, to control electrolyte levels, especially things like potassium, which can be toxic to the heart if the levels go very high, and to control acid-base balance in the body. Our bodies are made in such a way that, it has this natural rhythm where, one thing goes up either through our gut or liver or the kidney, controls it by bringing it down. But, if the kidneys are failing, then it's not able to do that anymore. So dialysis is really, really important to treat people like that.
So based on my knowledge, doctor, I see persons sit in this chair for hours where they have the system being flushed. Now, at HSA, obviously, you have world-class facilities that attribute to that process. Yep. In terms of your levels now, is it that if you have perhaps a discolored urine, that the time you'll go and get checked out, or what are some of the symptoms that you may readily want to go and see your doctor?
That's a good question again, So I think this is talking about the symptoms of kidney disease, essentially. So the first thing to know is that kidney disease is called a silent killer. Why? Because often people who have kidney disease don't have symptoms, especially in those first stages, stage 1, stage 2, stage 3, stage 4 chronic kidney disease. A lot of times people don't have any symptoms. They feel normal. They feel okay. They are able to go about their normal daily activities. But there are in a few instances where a patient may begin to see either blood in their urine, or they may have like frothy urine, like lots of bubbles in the urine, or maybe a person may find out that they are waking up a lot at night to go pass urine, or maybe if it's from an infection, they may just find out that they have burning sensation when they pass urine, or pain in the flank, where the kidneys are located. And those may be symptoms. But there are other subtle symptoms like swelling of both legs, maybe slight puffiness of the face, fatigue and weakness. One of the things I didn't talk about earlier about the kidney function is the kidneys help our bodies to produce blood. This is something people don't know. The kidneys produce something called erythropoietin, which acts on the bone marrow to produce red blood cells. So if the kidney function is failing, its ability to produce that hormone is reduced. And because of that reduction, essentially you have the person becoming anemic or fatigued. You can imagine a man, coming back home from work, is always tired, is always sleepy, that is a time to go test for kidney disease. When people have some of these symptoms, obviously that's a good time to go test for kidney disease. But people who already have risk factors for kidney disease, we may talk about this later. Things like as common as diabetes or hypertension, those are the common things that lead to kidney disease. Such people need at least once every year, twice a year, to go test for kidney disease.
And that's why it's very important to stay off alcohol. You have persons who may think that, let me have a glass of wine every single day, whereas have a glass of water or two is less than that. That will obviously cause the dissemination of your kidneys, right?
No, absolutely. And I think you make maybe we should take you as one of our nephrologists in HSA. You're making all the good points for us now.
Well, I read a lot on the human biology, doctor, so I'm a bit au fait of some of your terminologies as well, and based on what you're saying.
Yeah, absolutely. Yeah. But, I'm going to push that point further, take it from here and push it further. The island is pretty hot.
Yeah.
The island, most days you look at the temperature, you're looking at 32, 33, some days 34 degrees. You lose a lot of water from the body through perspiration, but also the ones that are insensitive. Just like I'm talking to you now, I'm losing some water.
Yeah.
Same thing.
Let me get a glass the next break, okay?
Right.
Yeah.
Yeah. So, there is that insensitive loss of water. So this is one of the reasons why it's very important that people adequately hydrate.
Right.
Yeah. Drink a lot of water on the island. And we usually say, anything between 1.5 and 2 liters of water, okay, or more, if your body can tolerate it. And as you mentioned, alcohol, causes a lot of damage to the body, whether the liver, the kidney, risk of cancers to the liver and other parts of the body, as well.
Well, I'm happy you make mention of that because recently it was said that we have a lot of drinking partners here and they desist from drinking a lot of water. Now, moving on to the dialysis, when does one or someone usually need the dialysis?
Yeah. So, like I said, I'll keep referring to this as we, go along on this interview. And that is the point about the stage of chronic kidney disease. So, I wish your audience could see me, where I will be able to bring in a chart, and show them the different stages. But I'm sure they will be able to follow. So, we have 5 stages of chronic kidney disease. Stage 1 is when a person's glomerular filtration rate. I know that's a big word. So what I try to tell my patients is like an estimate of the percentage of the kidney is working. So the kidney is working at 90% or more. Maybe the person has some protein in the urine, some blood in the urine, or they've done an ultrasound. There's an anatomical problem with the kidney. We say the person has got stage 1 chronic kidney disease. As long as that lasts for more than 3 months at a time, and more than 90 days.
And this is curable over time, right?
Yeah, well, it depends on what's causing it.
Okay.
So, for example, diabetes. So, kidney disease does not just happen. And that is why we say people should need to go test it. Because it happens slowly.
Right.
A person will not just become stage 5 chronic kidney disease. The person will go from stage 1, stage 2, stage 3, stage 4 into stage 5. And this means that if a person is able to identify that they have kidney disease earlier on, they can get treatment that can either reverse it, if it's a reversible situation, or treatment that can halt the progression. So instead of you going stage 1, 2, 3, 4, 5 in 5 years, the person can stay on stage 2 for the rest of their lives.
Really?
Yeah.
Oh, cool. Very interesting.
You get that. So that's one of the things that then makes it important for people to go get tested for chronic kidney disease.
Is there like a age difference, or is the older you get, it is incumbent upon yourself to go get tested?
Well, we talk about people who are at risk of kidney disease. And those people at risk of kidney disease will be people who have had diabetes, who have a diagnosis of diabetes.
Okay.
People who have a diagnosis of hypertension.
Mm-hmm.
And of course, as a person gets older, I think it's important to just go get yourself tested, for some of these simple, common conditions.
You're making reference to persons within their 45, 50, into their 60s?
Well, I would say anyone above 50.
Hey, what about
people
50?
like you and myself.
yeah.
We should get tested.
Exactly. We're talking to Dr. Ike right here from HSA. We are talking about dialysis. We're talking about that of so many aspects of your life, especially that of diabetes as well. Now, in terms of HSA, what kind of dialysis treatment are you guys offering?
Oh, we offer the entire spectrum of dialysis treatment. So we offer hemodialysis. Hemodialysis is blood dialysis.
Uh-huh.
And that means the person needs to come in to the hospital. There is a dialysis machine. We have an access from the person's blood that goes to the dialysis machine. And I think I need to state this now because I've had a few of my patients who are very worried and thinking that all their blood will be pumped into the machine at one time. No, we don't do that.
Yeah.
We're going to kill you if we did that.
Exactly.
So the blood goes slowly
Into the machine.
and
then cleanse.
and then the machine cleanses the blood and returns it.
into the body.
So it's just a small part of the blood that goes to the machine, being returned, and new blood going to the machine. So this goes on for like 3.5 to 4 hours at a time. And this is called hemodialysis.
Hemo.
It's Latin for blood.
Okay,
So
dialysis.
Blood dialysis.
It's the same way how you have like the gasoline engine works,
Oh, yeah.
where the gas goes into the filter,
Absolutely.
cleans it, and it comes out purified.
I'm going to tell my medical director to give you honorary nephrologist position.
I read it, doctor.
Let me also tell you about the other forms of dialysis we have.
Yeah.
So we have also something called peritoneal dialysis.
Mm-hmm.
We don't have a lot of patients on that now. And that one is the peritoneal cavity is the cavity lining the abdomen on the inside. So a catheter is placed into the person's abdomen and the person runs in fluids and the fluids run out, and the dialysis happens inside of the person, more or less. That is a very convenient form of dialysis. The person doesn't have to come to hospital.
Right.
You do it at home. And we can schedule to see the person in hospital once every month. Unlike hemodialysis, where the patient needs to come into the dialysis unit at least 3 times a week for each session lasting about 3 to 4 hours time. And then we offer something called continuous renal replacement therapy. It's also a form of hemodialysis, but this is more for people who have what is called acute kidney injury. So let's say somebody has had a heart attack and their blood pressure has dropped.
Right.
And therefore, their kidney function is abnormal, but the blood pressure is too low for us to use the normal hemodialysis. This form of dialysis is a slow and gentle form of dialysis.
Oh, they wouldn't put enough strain on the heart.
Exactly.
Yeah.
No strain on the heart, no strain on the tissue, the brain, and the blood pressure is not further, lowered. And then finally, we don't do kidney transplant, as you know, on the island, but we coordinate with centers overseas. And when our patients get transplanted overseas, especially like in the US, they come back to us and we continue to manage them and to treat them.
Very interesting. Now, in regards to persons who require dialysis on a monthly basis or weekly basis, how many patients can the Georgetown Dialysis Unit accommodate?
The Georgetown Dialysis Unit can accommodate in every session of dialysis because we have 13 beds there. So, and we can have up to 3 sessions of dialysis in a day. So that means in one day we can accommodate up to 39 people.
39.
And this can be stretched, So if we have, and as we are likely to have more people requiring dialysis, we've looked at our registry numbers and we can almost point out in the coming months, years, that we are going to, the dialysis unit in Georgetown is going to grow bigger. And one of the things we may need to do to accommodate more people is to actually increase the number of shifts that we have for dialysis. So currently we can accommodate 39 people on Monday, Wednesday, and Friday, and we can do the same thing on Tuesday, Thursday, and Saturday. That is the usual schedule. I'm just pointing that out.
Yeah.
That's the usual schedule for dialysis. So people who are dialyzed on Monday will come back on Wednesday, will come back on Friday.
That's 3 times for the week.
Oh, yes. It's 3 times a week, and each session lasts for about 3 to 4 hours each session.
Oh, wow.
The patients are left in the unit now. They came in this morning around 7 a.m., and they are coming off now, around about now.
Like a shift system.
Yes, they will come back on Thursday, and then they will come back again on Saturday.
Right.
And they will continue to do so for the rest of their life.
Oh, wow.
Yeah.
That's why it's very imperative people like to take care of your bodies.
Kidneys, exactly.
Kidneys, exactly.
Yep.
So with the population being increased right now, do you find that we're being stretched or just to manage the volume of persons who are coming in to be dialyzed?
We are being stretched, but the system, it's HSA. You and I were talking about this offline earlier. HSA is, a very good organization.
Oh, yes.
And we have 2 nephrologists. Oh, my colleague couldn't be here. He's in clinic now, Dr. Paul Laboy. So there are 2 of us. We're able to manage the clinics, manage the dialysis unit. And I think something that we must point out, that for us as nephrologists, it's not just managing the people who need dialysis. A good mark for us that we're doing our work well is to reduce the number of people who actually come into dialysis.
Yes.
So if
that's they need to send the message right about proper health care or
absolutely
care. Yeah.
Absolutely. So those people we pick up from clinic who have kidney disease, our goal is to treat them. That I was pointing that out earlier, to keep their kidney disease from progressing from stage 3 through stage 4 to stage 5, where they begin to need dialysis. Because the fewer patients we have on dialysis, the more we feel that we are actually improving
our services.
Absolutely. From the clinic. But obviously, people will still progress and need dialysis eventually.
Okay, people need not to go nowhere else. HSA is the place to go for your dialysis. And when you're there, ask for Dr. Ike. I want to call his full name. He's talking to us right now, courtesy of the Health Services Authority right here in the Cayman Islands. We stretch 3 islands, right? We have the BRAC as well. We have Little Cayman. And here in Grand Cayman, we offer all the services. Now, what about over inside of the sister islands? You provide a nephrologist as well and a dialysis service?
We cover the sister islands, the BRAC specifically. So Dr. Laboy and myself, we go there once every month, each of us, which will be once every 2 weeks. We go see patients there who have chronic kidney disease. So we run clinics there. We fly out there in the morning, come back in the evening. But we have a dialysis unit at Faith Hospital in the BRAC. And currently we have 5 patients there who are receiving dialysis on a regular basis, following the same schedule that we use here. Some patients are dialyzed on Monday, Wednesday, and Friday. Others on Tuesday, Thursday, and Saturday. But again, when we look at their numbers in the BRAC and the people we see from clinic, there is a good likelihood that within the next 6 to 12 months, that number may actually double from 5 to up to 8 or 12 people, 10 people, he may be needing dialysis.
And again, these are persons over their 50s.
Oh, yeah. So most of our patients on the island, and that's a good thing actually on the island. I must say, when I first came to this island 7 months ago, I realized that there is longevity on the island here. I don't know what the food is on the island that makes it really very long.
Doc, perhaps you can attribute that to the food, but certainly I think persons are being sensitized more right now in terms of eating healthy, exercising, drink less as well, and drink more water, certainly.
Absolutely.
And this will help to give them longevity.
Yeah.
So that's my opinion in terms of the factors.
No, I agree. I agree with you. But a lot of our patients on dialysis, for instance, if I give you some statistics about our Georgetown Dialysis Unit, the age range of our patients on dialysis ranges from 27 to, guess what, 92. We have a 92-year-old.
92.
We have a 92-year-old man who is on dialysis. He's been on dialysis for the last 6 years. Most of our patients are male. About 65.5% of them are males, and the others are female. Talking about age, 50.8% of our patients are over 65 years old. Okay, so that tells you a lot of our patients are pretty elderly.
Right.
We have about 6 people who are more than 80 years who are receiving dialysis, and up to 15 of them who are more than 72 years who are receiving dialysis.
And that's pretty much good in terms of the age group and, their age capacity moving forward beyond 65.
Absolutely.
Yeah.
Yeah.
The Bible said we gave the Father of above gave us, is it 3 score?
3 score and 10. And if by strength we get to 4 score.
Yeah, exactly. So with that being said, that means we're throttling good.
Oh, we're throttling good in the Cayman Islands. And,
yeah.
The Health Services Authority make sure that patients who come to that hospital are well taken care of. It doesn't matter. And that's why I gave you this age spread, which is really a representation of what we have on the unit.
Right.
It doesn't matter whether you're young, whether you're middle age, whether you are elderly, whether you are very elderly, like we have in our unit, we will still take care of you and give you, the best form of healthcare you can get compared to anywhere you go into the world. I can tell you.
No, well, I can testify about the services from HSA, not only for, let me knock, is this a board?
Yeah, it is a board. Let's knock on it.
Let me knock on board, but, there are so many other amenities that the HSA provide, and I can give testimony about them as well. Now, we cover the Cayman Islands all the time with the clinics up inside of the Eastern District, with the clinics in West Bay as well. The question is, a new West Bay Dialysis Center, just read up something about that recent. Is it in full operation?
It is, as we speak, in full operation. So the dialysis unit started, it had preceded, myself. It had started a while ago, and trial, and then I think there was a hiatus. And then this year we decided we really want to open that unit. And I'll tell you why we wanted to open it. The patients who come to HSA, Georgetown, in our dialysis unit, Georgetown patients represent 43% of our patients. West Bay patients represent 23% of our patients. Patients from the East End, 6.5%. And from Borden Town, about 28%. So there is a need to actually not centralize, our care service.
Right.
Just here in Georgetown alone. And since we have a clinic there and a dialysis unit there that had been, in operation before, we decided it was time to, get it running. And this month, I think earlier this month, the Honorable Minister herself for Health, Honorable Catherine Ebank Wilkes, and the Premier, Honorable Andre Ebank, are there to actually grace, that opening and open that dialysis unit, along with other officials, including our medical director, Dr. Jeff Delroy Jeff, who was there as well. So that place is now operational. Our patients who are from
West Bay, yes.
In fact, one of our patients, I'll tell you this, because I can't tell anybody's name. No. He lives the street behind the dialysis unit.
Okay.
So it's pretty much, very convenient
walking
to just come into the You can imagine a day like yesterday when it was pouring rain in the morning. It could be easy access for him to get to the dialysis unit. In the past, it will have been, a tough,
difficult ride.
Yeah, coming into Georgetown for dialysis. So opening that unit has been very convenient for our patients, and it's been, fantastic that we have an outreach point right there.
So, Doc, it's safe to say that HSA is making healthcare great again.
Well, I don't know if we can. Can we turn that into an acronym? We could possibly do that. We could say
or greater.
No, let's do it. Let's do it island way. HSA is making waves.
They're making waves.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Well, welcome, on behalf of the Health Services Authority. There's a myriad of questions in which we're going to be talking about today. And first up is that of the dialysis service over inside of HSA. As we speak of the dialysis center, what equipment and safety measures are in place down in the West?
So at West Bay, we have state-of-the-art dialysis machines, the same ones we use here in Georgetown.
Mm-hmm.
I don't want to start branding them, but they are, I can tell you.
They're tipping the top.
Yeah. They're the top brand.
Top tier.
Top tier.
Yes,
exactly.
yes.
Dialysis machines that we have there. And the nurses we have there who look after our patients, they are nurses who are accredited in advanced cardiovascular life support because, let's be honest, the patients who are on dialysis, many of them have risk factors, for cardiovascular events. Either they are diabetic or hypertensive, they have heart problems, and so on and so forth. But those nurses are equipped, to be able to take care, of those patients. We don't have, because it's a small unit, has capacity to look after a maximum of 12 patients now. Although we just started small, we don't have a nephrologist posted out there, but we are in regular communication with our nurses. There are doctors there, obviously, in the facility, such that if there was ever an emergency, there are people who will firsthand, be ready and available to take care of the patients there.
In the medical term, there are so many big words that are oftentimes used. Now, I want to elaborate on nephrologist to our listeners right now, for those who are here using the word and said, what is he meant? What is being meant by that?
By a nephrologist.
Nephrologist, yeah.
Preston, big word. Preston, this is one of the things that I throw out at parties. When people ask me, what are you as? I'm a nephrologist.
Yeah.
And they start guessing, what does that mean? It's funny. When you say a person is a cardiologist, everybody knows that.
Here you go.
It's a heart doctor.
Mm-hmm.
So a nephrologist is derived from, nephro or nephron, which is Latin word for kidney. Rain actually is the Latin word for it, or renal.
Renal, right.
Yeah. So nephron is the functional unit of the kidney. So a nephrologist, the person who looks after those functional units of the kidneys. There you go.
There you go.
When you say nephrologist, you're talking about the kidney.
Yeah, that's who we're talking to right here on Bopo 103.1 FM. Dr. Ike, we're talking about dialysis. We're talking about him being a nephrologist. And certainly so many information is being gathered right here as we come to you from this frequency. Now, going back to West Bay, in terms of the opening hours and operational hours, what are they?
So West Bay unit opens Mondays, Tuesdays, Thursdays, and Fridays from 8 a.m. to 4 p.m. And this is to enable us accommodate patients who need dialysis there. And on Wednesdays, we open from 12 p.m. to 8 p.m. And this midweek late shift is particularly helpful for people who are still working, so that they can go to work, and still be able to come to dialysis, after their work hours. But I must just say that, the quality of care that we provide at here in Georgetown, we provide exactly, not 1 point removed, exactly the same quality of care.
I was just about to ask
West
you,
Bay,
listen, man, if you're in the West Bay community or district at this time, you can always get over to the HSA and the same quality that you will receive in Central Georgetown, will be disseminated to our friends from West as well. Now, in terms of patient care and outcomes, I mean, how long do patients usually need for this year dialysis treatment? You did make mention about 4 hours previously. Is if something is going good with the personal metabolism, can it be less or more?
It's a good one, Preston. We have a patient who just started dialysis about 3 weeks ago, 79-year-old woman, diabetic, hypertensive, started dialysis about 3 weeks ago. She still has what we call a good residual kidney function. So even though the kidneys have failed, so usually we start dialysis when the GFR, glomerular filtration rate, or the proportion at which the kidney is working is less than 10%. Hers was about 6.5%, but she was still passing out adequate amount of urine.
Right.
So a patient like that, what we do is to do what we call incremental dialysis. Incremental meaning, although conventionally we say dialysis is 3 times a week, each session lasting at least 4 hours, we started out on once a week dialysis.
Okay.
So she comes for dialysis only on Thursday, and that helps her, the point you just made in terms of like metabolism. So that helped her metabolic process. But as we notice in future, if her kidney function continues to go down as it would, and I expect it to do so, we will slowly increase dialysis, maybe from once a week to twice a week to thrice a week. But, you are saying something about outcome. Our unit here has a great, for a small island, you would think, well, they don't do very well there. We have the longest patient on dialysis in our unit. I tell you to guess, I'm sure you will not guess. 17 years.
17
years she's been on dialysis, followed by another gentleman who's been on dialysis for 16 years, followed by another person who's been on dialysis for 14 years. And these are people who have a lot of comorbid factors. Some have been amputated because of diabetes,
right,
had heart problem. But the unit, still working to make sure we keep them going, keep them healthy, to improve their quality of life as well. So in terms of dialysis outcomes, our unit is doing great. Dialysis usually requires that the patient will, because the kidneys have failed completely, be dependent on it for the rest of their life.
Right.
Or until the person is able to get kidney transplant. And that is one of the things we're trying to really push on in our unit now. So patients we have in our clinic at Smith Road with early on kidney disease, by the time they get to stage 4 kidney disease, we start talking to them about transplant. Importance of, thinking about it, being worked up for it, and going for evaluation. Because a person can get what we call a preemptive kidney transplant. The preemptive kidney transplant is, person is stage 3 kidney disease, stage 4 kidney disease. We start working the person up for transplant. By the time they get to early stage 5, which is the advanced form, if they have a donor and, everything is working out well, they get a transplant. That way they jump dialysis and never require dialysis, So this is something we want to put out there to sensitize people about, increase awareness to people in terms of what is possible. Because I think a lot of times people don't know that these things are possible.
So because some people may think that it's an end of life situation, but not realizing that you did make mention about having a donor.
Yeah.
Is it something that we can get, or this individual is within the Caribbean region here in Cayman, or you have to seek elsewhere on the outskirts to find this donor? How do you go about in soliciting that?
So currently we don't have a kidney transplant, program, as it were, on the island. And I think that is being developed as we speak. But there are people on the island who, you speak to a family member or a friend. Donor is anybody who is willing to give you a kidney. God is great. He gave us 2 kidneys.
Yes.
Because he knows we can do it one.
Exactly, yeah. Well, yeah, I've heard about individuals who are their livelihood with one. Yeah.
They're born with 1 kidney. There are lots of people who are born with 1 kidney. They don't know, and their kidney function is normal.
Right.
And when people donate a kidney to a person that they know or they just donated, they still live, well with 1 kidney. So it's just a question of, creating that awareness.
Yeah.
Instead of hiding and saying, I have kidney disease, I don't want to let anybody know about it. Talk about it at family gathering. Did somebody ask you, why did you've been going to hospital, frequently, what's going on? Tell them that I have kidney disease. The doctor says it's nothing to be ashamed of. Lots of people in the world have kidney disease, and my kidney disease is advancing. I may need a transplant one day. And if they have questions, you can tell them, maybe you want to speak to my doctor.
In a way, doctor, not many people out there feel compelled in speaking about their situations. Sometimes people get a bit withholding, get a bit sheltered as well, not realizing that, there's care that is out there rather in terms of taking care of yourself. In regards to dialysis now, what specialists are involved in the patient dialysis care? What kind of care are you offered during the time, whether it be 15 years, 10 years, to these individuals, apart from just having them on the machine?
The machine.
Yeah.
So we try to practice a multidisciplinary approach to our care of our treatment of our patients. I am a nephrologist. We have nephrology and dialysis nurses in our unit. We do not provide the care alone. I can tell you there are lots of people who are both specialists and non-specialists who are involved in the process of care. People like the EMS service.
Yeah.
They go to pick the patients from home. If they don't pick them from home, how are they going to get for them?
Exactly.
You know what I mean?
Yes, yes.
And they do that promptly, being aware of our dialysis schedule. So, this is a shout out to those people. We never hear about it, but shout out to them.
Behind the scenes working all the time.
Behind the scenes, they are working, and making sure that our patients get to the dialysis unit. But beside the nephrology, beside the nurses, we have renal nutritionists. Because as the body is not being able to handle all this metabolism, you need somebody to guide you on what you eat.
That's why diet is very important.
Oh, absolutely. Very, very, very important. So we have nutritionists who are there to help us. Our pharmacists are top notch. And I'm not just saying this to make anybody happy. I mean it.
Yes.
They call me from time to time to, guide me and say, Dr. I, you prescribed this for this person. We have an alternative medication that may even be better for them that I may not be aware of, that we have in the hospital pharmacy. So I think all of these people are surgeons, they are involved in the care of our patients. So we utilize a multidisciplinary approach. There are people also to mention here, our psychologists and our mental health care provider. Because let's be honest, Preston, for a person to wake up every morning, go to a dialysis unit 3 times a week, sometimes it begins to get on a person.
Yeah, I was just about to ask that. So what kind of psychological treatment to give for persons to say, listen, don't give up, keep on, it's for your own betterment?
Yeah, we talk to our patients. We try to be, there for them. And if somebody has been in the unit for 17 years, for 10 years, you become familiar. You're not like patient doctors anymore.
Right.
You know about them.
You see them 3 times a week.
You see them
for long hours.
Exactly.
Yes.
Long hours every week for that long period. So you become families essentially. So we talk to them, we try to cheer them up. We can notice when things are not going well. Sometimes we even bring the families there, we have discussions with them. But when we begin to realize that, people are having mental health, problems, depression, psychological issues, we have specialists. We have a specialist, psychologists, counselors, people in the mental health department who they're able to ask, to come help us, talk to them. They are experts in that work. So beyond me just counseling and encouraging a person, they have the key tools. They know how to draw out information.
Yes.
From them, and know how to give them the right information that they can give to them to help lift up their spirits. And, it's not just the body we take care of. We're taking care of the body, the spirit, and the soul.
Soul, yes, ma'am.
So all of that is good. And when our patients come for dialysis, we have comfortable chairs. We have TV monitors. You don't just sit there. You don't just sit there for 4 hours.
Right.
Just looking at people walking up and down. You have things that can, help you.
Get them involved.
Yeah.
Right, Cayman, if you're just tuning in, it's Bobo 103.1 FM. We're talking to HSA nephrologist, Dr. Ike, right there. Why don't we take a quick break right now if we can get a glass of water? We'll be come back more pertinent questions surrounding dialysis, the outcome, and how would we compare ourselves with that of our international counterparts as well. Keep it tuned. This is Bobo 103.1 FM. We're here instead of the HSA Hour. We have Dr. Ike Okpechi. We call him Dr. Ike for short, and we're talking about the dialysis service at the HSA same Georgetown Hospital. Now, we have a few minutes to go before we wrap up that, but question time again, how do the HSA dialysis outcome compare internationally with other counterparts?
Yeah, so we have done one comparison in the past, and this was in 2020. A comparison was done about, mortality, from the dialysis unit here. And in the U.S., they have what is called the USRDA, United States Renal Data System. So they are able to provide data across the entire United States, number of people who are on dialysis, number of people on chronic kidney disease and mortality and all of that. And in 2020, Cayman, did far better than the United States in mortality. Mortality in Cayman Island was 8.5% in 2020 compared to mortality of patients receiving dialysis in the United States of 16%. So it means like we had half the mortality rate of, the United States. But, you and I were talking about this also offline earlier about, the quality of care is here in Cayman Island. I will give you a statistic from Africa. In Africa, a paper published in 2017, and I know about that paper because I had to write an editorial following it. Over 90% of people with end-stage kidney failure who need dialysis die within 3 months. And that is because of out-of-pocket payment for dialysis.
That's very alarming.
That is very, very, very alarming. And that is very alarming. And so Cayman Islands, is doing very well, excellently, punching above its weight, I would say.
Yeah.
We may be small on the map, but it is punching above its weight when it comes to, the quality of service. I will speak for nephrology now.
Yes.
Quality of renal or nephrological service.
In layman term, some would say we're little, but with talawa.
Oh, yeah. You have to teach me that in Patwa.
Yeah. We're little, but with talawa.
Okay. We're little, but with talawa.
That's right. Now, in looking ahead, we are now in 2025, 2026 is coming. The next quarter is going to be finished in a matter of a month. What are some of the biggest challenges, for dialysis patients right here in the CI at this time?
Oh man, it's the frequency, but there's really nothing one can do about that. We try to encourage our patients all the time, but it's not very easy for patients coming for dialysis. 3 times a week, you lay down there for 3-4 hours, but it is a life-saving, treatment. And, I think that is, really, one of the challenges that patients have. The other challenge is lifestyle. A lot of our patients are people who have, diabetes or high blood pressure or heart disease. And then, you have to cut down water. You need to cut down this.
Yeah.
You need to cut down that. And then after church on Sunday, you go for the family lunch. And you're just sitting there looking at everybody eating and not you.
Yeah.
Let's be
real distant heart.
It is a challenge. And I acknowledge that. But we try to encourage our patients that, the things we tell them in terms of their diet, in terms of their fluid intake, especially that time when they begin to need dialysis, restricting it. Because, the person needing dialysis, many of them are not able to pass urine anymore because the kidneys have completely shut down.
Right.
So every fluid, ounce of liquid you take has nowhere to go, and it sits in the lung. So
they have to go at the exterior.
Exactly.
Yeah.
The patient begins to come in with shortness of breath and all of that coming to emergency. Those are some of the challenges, that patients have. But we have started a big education program in our unit where we try to educate patients, on the need for adherence and the need, to follow a particular kind of lifestyle, and just talking to them generally about the complications associated with dialysis. Because when they are aware of this, they are more armed
to take care of themselves and sensitize others around them as well. In terms of education, I didn't make mention of that. But what about you continuing to improve the care of the dialysis unit?
We continue to make sure that the staff, it will be myself, the nurses, we continue to attend medical education programs, to help sort of retrain us and help upskill us, in what we do. But, also bringing in new technologies, to help upgrade the technologies that we currently have. We've requested for a few machines now, dialysis machines, other machines that can do other things,
So you're looking at more state of the art.
Oh, yeah. So we increase our status, from that point of view. We're doing that just to make sure that we remain, well-trained at all times. We remain well-informed about what is new on the market. What new drug is available there to treat our patient. What new technologies are there, that we know when we bring it in, it's going to help improve the quality of life of the patient who comes to our dialysis program. And not just that, even the patient who don't need dialysis, who are in our pre-dialysis chronic kidney disease clinic. We're organizing educational programs. And there are other things we are thinking of doing in the near future. Maybe you will soon start hearing about them. I don't want to let the cat out of the bag. Yeah. But, things like that, and we are trying to also invest in measures, preventative measures. They say prevention is better than cure. So if we can help inform and create awareness about kidney disease among the population, a lot of people can prevent that, from really happening. And the last thing, I think I mentioned it earlier, we continue to coordinate with international transplant centers because we don't have transplant here.
Right.
So one of the things we want to do, especially, if the person is elderly, they may not be considered for transplant anymore because they are very elderly. But for those ones in their 60s, in their 50s, in their early 70s, because if a person gets a kidney transplant, why not? That kidney can serve you for the next 15 to 20 years of your life.
Absolutely.
So we are making sure we increase our coordination with our transplant, centers overseas to make sure our patients are evaluated, that everything our patients need to do, that they have them ready, it's all done, cleared, and they are listed for kidney transplant.
As it relates to donors, quote unquote donors, or sometimes there's like a catch figure applied.
You mean in respect to donor?
Yeah, do they actually give you a kidney, or they say, okay, well, it's going to cost probably $10,000, $5,000?
Oh, no. So if anybody who is listed, so some of my patients are listed in Cleveland, Florida. So because they are listed there, they don't have their own donor. Once they continue to rise up on that list, and get to the top of the list, when it is their turn, in fact, we just had a patient who got transplanted like 3 months ago in the US. He didn't go with a donor. He got a kidney from the US.
Oh.
Yeah. So as long as we coordinate that and make sure our patients are listed there, then that obviously is not a living donor transplant. That is deceased donor transplant.
Oh, well,
You follow what I mean?
Obviously, there has to be some form of compatibility with your body structure. I don't know the real terminologies, but certainly there has to be some compatibility with the self and the donor.
Yeah, just to make sure that there are no antigens and antibodies that reject the kidneys when the person gets it. So part of the workup is to check what's your blood group. Okay, so this person is this blood group. What is the HLA type? So the HLA is like the things in our blood that leads to rejection of an organ, helps us to fight when a foreign body like an infection comes into our body. So once they have all of that type, if it is a living donor, which means we are bringing somebody from Cayman Island, or be a family member or a friend who wishes to give you a kidney, they test that person to make sure you and that person, you match.
Exactly.
Now, but if you don't match with that person, what they could do is to do a paired donor transplant. Paired donor transplant means you don't match with your donor from Cayman Island, but there's also somebody from the US who doesn't match with their own donor. So they give you that person's donor, and they give your donor to that person, more or less, But otherwise, if you don't have a donor, so it's deceased organ transplant. The person is listed in the waiting list for the transplant. And as the person goes up on that transplant list, when a kidney becomes available, and how does the kidney become available? Kidney becomes available. Somebody had an accident. Somebody had a heart attack. They speak to the family. The family say, we are happy for you to use the organ. There are 2 kidneys. One can put one person and another to another person. Then they do that same test, the person's blood group and height, HLA, and then they look through that list. Who does it match with? Or it matches with this person from Cayman Island. And then they call. And when they call, what we do, we fly the person out immediately. So our patients on dialysis, they know, the ones who are listed, that their passports, their travel documents have to be ready. Because you don't want to be called and you say, your passport is expired.
Exactly. No delay whatsoever, because there's a certain amount of urgency with this year transplant as well. I'll wrap it up in a matter of a minute. And what message would you give the people at risk for kidney disease, Barry?
So the one message I would give to people out there, if you've never had your kidneys tested, go to your GP, go to your doctor, and just get it tested, your kidney.
What's the method?
I'll say. And I'll tell you the people at risk, the people who really need to be tested. If you know you have diabetes, if you know you have high blood pressure, if you know you have family history of kidney disease, do somebody in your family before was dialysis, years ago, an uncle, an aunt, a parent, whatever.
That means it's hereditary.
Yeah. So go get tested. What is the test? It's a simple blood test where they check your creatinine. When they check the creatinine, based on the creatinine level, we can estimate the level at which the kidneys are working at. And that way we'll know whether the person has kidney disease or not. There are people who need to be tested, are people who have been, and I think we were talking about this earlier. There are a lot of people who have arthritis. They've been taking a lot of pain medication for many years, non-steroidal anti-inflammatory drugs like ibuprofen, like Acoxia. Those things can cause damage to the kidney. If you know you've been doing that, go see your doctor and ask your doctor if you can get alternative pain medications, because obviously you need pain medications, but you need to get your kidneys tested.
And while saying so, don't think that the Bush method is the alternate way. Seek proper medical advice.
Absolutely.
Because, sometimes I say, let me drink some ginger tea and the pain may go away. Or drink some Cersei, not realizing that you may feel that way subliminally, but in essence, it's still causing problems. Go and see your medical practitioner over by the HSA, right, Doc?
Correct, Preston. Our advocate nephrologist in the house.
That's right. Right. Now, in wrapping up, we've been talking about the HSA for the past 45 minutes, 50 minutes right now, but question time now, and I'm sure our listeners out there, whether they hear in Cayman over in the BRAC as well, who are streaming online on stingraymedia.com, how can patients and families learn about dialysis services at the HSA?
The easiest way is to call our dialysis unit. You can reach us on 244-2624 or 244-2769. Or you can send an email to info@hsa.ky. And just your email say, I want to know more about dialysis. And it will direct your email to myself or to Dr. Laboy or to the nurse manager, Nurse Erlin, one of our nurses, to say, somebody's requesting, to get knowledge about, kidney disease. And that way we'll be able to respond.
So you have some form of consultation prior to?
Absolutely. Yeah. If it just means scheduling an appointment to see the person in clinic, we will do so. We are open to scheduling an appointment, requesting tests, to be done. And if tests are done and we think your kidney function is fine, we may not even schedule an appointment to see you. All we may just do is just like either by phone call or by email say to you, your kidneys are doing good. Test yourself annually or test yourself at least every 2 years, for your kidney disease. Something else to just point out, Preston, before I don't want to...
Yeah, go ahead.
I think this is very important. It's also important if you are like Preston or myself above 50 years, check your blood pressure on a regular basis.
Mm-hmm.
Because hypertension is something also that is known as a silent killer. Most people don't have any symptoms. So just from time to time, once every 3 months, once every 6 months, go to the pharmacy, or if you have someone who has a blood pressure, or go to your nearby clinic. Just say, I want to have my blood pressure checked. And what is the ideal blood pressure? Because it's not just enough blood pressure.
Because you may have it high,
yeah,
super high, and perhaps even super low as well.
Absolutely. So the ideal blood pressure for anybody in the general population would be anything less than 120/70.
Mm-hmm.
That would be like ideal. But lots of people have blood pressures higher than that. If your blood pressure is not that low, it should be anything less than 130/80. Anything above that, then we begin to talk about hypertension. You needing treatment for high blood pressure. If you go check your blood pressure and your blood pressures are like 160, 170, go see your doctor as soon as possible. I think that is really, really, really important.
Raising an alarm right there.
Absolutely.
Wow, amazing. So much I've learned today, Doc, and trust me, a wealth of knowledge, and I'm sure our listeners are pretty much, exuding the same gratitude as well. And we oftentimes have our friends out of HSA, the HSA moment, right here on 103.1 Bobo FM. Join us throughout the entire week, where we're going to have a lot of specialists from HSA passing by to give us all the information, vital information that you absolutely love. And the obvious, take care of yourself. We speak about some of the symptoms that you may see from time to time, and go check it out. Do not procrastinate, because knowledge is power, right, Doc?
Absolutely.
So when you have knowledge about your status, then give you another probably 10, 15, 20 years.
Oh, absolutely. And people should not be afraid if they say you need dialysis.
Mm-hmm.
We don't usually recommend it for anyone. We only recommend it for people with kidney failure. But if you found out earlier that you have early form of kidney disease, that knowledge gives you power, like you say, to do something about it, to make sure it doesn't progress to the point where you need dialysis.
Mm-hmm.
So really, knowledge is power. So go get yourself tested for kidney disease and check the status of your kidney.
And the well-experienced nephrologist will be at hand.
Absolutely. Either myself or Dr. Paul. Dr. Paul, if you see him, he's tall.
He's tall.
He's taller than myself. So we call him Dr. Longus. And I am Brevis. So look for Longus or Brevis in the dialysis unit. One of us will take care of you.
All right. And remember, one more time, call directly at 244-2624 or 244-2769, or email info@hsa.ky, or check out HSA website at hsa.ky. Anyone with questions, reach out, and there are lots to help at every stage of the journey. And HSA right there off Smith Road, they can't miss it right now, Grand Cayman. And the good thing, if you're listening to the interview previously, as we move along, West Bay, they're now having their new dialysis center, and they boast all the amenities like what we have inside of Central Georgetown as well. So get over and again get tested. On behalf of Bobo 103.5. On behalf of Bobo 103.1 FM, your boy Preston, keep it a company. And again, it was a pleasure talking to Dr. Ike. Full name?
Full name, Dr. Ikechi Okpechi.
All right, good to have you, sir, and thank you for passing by.
All right, thank you.